Anemia is sort of a lost disease, I guess, or a lost entity. It bridges so many different facets of medicine. Hi, my name is Susan Goobie. I am based in Boston, and I am from St. John's, Newfoundland, Canada. I am a pediatric anesthesiologist at Boston Children's Hospital. I am chair of the American Society of Anesthesiologists Patient Blood Management Committee, and I am editor-in-chief of British Journal of Anesthesia Open. Every day I see patients who are anemic, and every day the lab work comes the night before their surgery. And I was always sort of a little perplexed as why this was always ignored. A hemoglobin of, 8 or 10 or 9. Why was this just ignored and accepted? I think that's a low-hanging fruit that is something that we can work together with our surgeons and nurses and pediatricians to help diagnose and manage better, because we shouldn't really accept this as normal anymore. Personally, yes, it doesn't relate to pediatrics, but it does relate to my 97-year-old father-in-law and my 88-year-old father, who were both severely iron deficient. And in my father-in-law's case, he was being treated with oral iron and wasn't responding. I actually gave them both the book. My dad read it for the first time ever. He understood why he had to take iron pills every day. And he said, it really helped me understand. And I really never understood that from my doctor before. In the end, when he read the Bloodworks book, I think for the first time he understood in his own, mind what it meant and the implications of it. And it really helped him be more compliant and kind of understand why this was such an important thing for the doctors to help. You have to give clinicians and anesthesiologists the benefit of the doubt. And, at the end of the day, they're just trying to give the best possible care to their patients with what they know. And, that's why, there was a recent initiative from the World Health Organization on guidance for implementing patient blood management to improve global health status. There's a toolkit that was published, and I was involved with a group to help formulate that toolkit. Honestly, I think that we need to do more education. It's not that anesthesiologists don't care. They very much care. But they just don't know. It's one of the hardest things, is changing culture. And we've always done it that way. If the patient's anemic, well, we can just give them blood. And, just sort of changing that culture is extremely hard. Clinical decision-making can help, but computer platforms that help real-time decisions, so that if an anesthesiologist orders a test or a transfusion for a patient, there's clinical decision support tools that can pop up and be a quick read that you can say your patient's hemoglobin is 10, that with evidence-based recommendations, it's not recommended to transfuse unless they're hemodynamically stable. So it's really telling the physicians, treat the patient, not the number. And so these clinical decision support tools can be built in to our EMRs, so that it's real-time feedback for patients, for physicians, for patient care to say, boom, this is the evidence. Treat the patient, not the number. We really care, and we want you to know that we really care, and we want to individualize our patient care for you and your child. It is your prerogative. It's your body. It's your health. Ask questions, and if you don't get the answers, keep asking.